As if we're saying it's like, oh, I have something to ask, but it's relevant.
It's relevant.
Like
so
on the pre-chat, like if it matters if it's relevant or not. But I appreciate your enthusiasm.
I thought I could save my question in case anybody else
No,
has it.
I appreciate it. It was just like, oh, I have it, but it's relevant. I think one of the pre-chats we talked about children getting their face wiped, which is now like a screenshot.
Oh, it is.
I love it.
We also talked about your motorcycle days.
I miss
on
my
the
motorcycle
pre-chat.
days. Welcome to the Medicare Cafe. We are on the pre-chat section, so if you're watching the recorded version of this and you're like, just give me to the Medicare stuff, first of all, who hurt you as a child? Second of all, fast forward a couple minutes. Today we're going to be talking
Or not,
about
because I have
Shorten.
a relevant question.
She does have a relevant question, though. So let's hear it. What's your relevant question?
Last time we talked a little bit about Medicare Center and how I'm using Medicare app for my PDPs.
Mm-hmm.
Where do I go to find the training on Medicare Center?
I'm so glad you asked. So there's a couple different places.
Because I tried like finagling and I was like, nope.
Well, number one, anybody at our office, including myself, would be happy to give you like a personal tour, a personal walkthrough. So that's an option. Okay. But Anna Patrick, Medicare beer.
Did you know I changed my TikTok name to Medicare and I hashtag Medicare every time because of you, Brian?
That's the coolest.
Total credit to you.
I don't like that. But compose. So. Anna Patrick from Integrity does weekly trainings on this live. Okay. She does weekly live webinars, but she also records and stores them too. So if you want to watch like past just one-off videos or past webinar trainings, then just go to, honestly, if you go to integrity.com, there's trainings on there. But you can go to under Learning Center there. You can go to Learning Center and there's some trainings there. But on their Vimeo page, if you just go to Medicare Center and look at Medicare Center's Vimeo page, that's where I just link people all the time. Our website.
So go to Medicare Center or Integrity?
You can do both. Here's what you're going to do. You're going to go to smsteam.net. Okay. Click on Medicare Center. Okay. And follow the links to get you to the trainings. That's the easiest. Okay. I try to give you variety is the spice of life. Sometimes it means confusion.
If I can't find it, I'm going to call you.
So just call me, or just like call us and we'll handle it.
Is the short-term health ruling final?
It is.
The what?
It sure is.
Short-term health?
So, but it's grandfathered in. So here's what's going on. And Brian, if you're talking about something different.
I feel so clueless every time I'm here lately. So clueless. I think you need to find a replacement.
To be fair, every time I walk into this building, I'm just like, what's going to happen today? What am I going to learn?
This was my last episode, guys.
There was a rumor on one of the social media sites that, no, I would never. I
don't know what we're talking about.
So there was a, well, I'll get to Brian's question, but let's go a little gossip first. Okay. I've been watching Bridgerton. Bridgerton?
That's a good one.
Is it Aten or Urton? I've been watching the show. Okay. So now I'm all about like, let's drink some tea and gossip about the Ton. Here's what's happening on the Ton. So there was a post made over the weekend talking about how United Healthcare was getting rid of their NMAs, which is of course the highest level contract, the contract that we have, and that how, they're eliminating FMOs, no more hierarchies, blah, blah, blah. That's not true. So don't believe the news of the Ton. Don't believe it. Lady Whistledown did not put that in her little pamphlet. That's not real. And was quickly debunked by Rachel Hurtado, who is basically HBIC on the external distributions channels for UHC. So she would know. But what's going on with the short-term care market? There was some tea that no one asked for. Here's what somebody actually did ask for. Short-term care. So right now, the rules and regulations short-term care allows these companies, short-term care is like an alternative to the ACA. Okay. And so what it is that it's not, basically you can purchase insurance that can last 3 months, 6 months. Now lately they've been going up to like 3 years. 3 years. Yeah. And so early in the ACA days, those were not allowed to go beyond like a 3 or 6 month period. But with other regulations, those became more and more relaxed. Okay. Starting September 1st, they're going back to you cannot do it more than, I think it's Brian can let me remind me, is it every 6 months? It's every either 3 months or every 6 months. You cannot have a short-term care policy last longer than that. However, if you are writing a short-term care policy that's the 3-year policy, those will be grandfathered in. So make sure you get your 3-year policies before September 1st, because those will be grandfathered. Okay. So there you go. Thank you, Brian.
So can you reapply after those 6 months?
Yes, you can reapply. There is a rule, there is a regulation saying that you do have to switch plans. You cannot re-enroll in the same plan every 90 days. You have to do a different plan or a different carrier every 90 days. Okay. But again, you have until, and not renewable. Yes, Brian, thank you. So that is something that's coming up. So if you are in that market and you're getting ready, we're talking about AEP prep, also realize a lot of our short-term care agents are going to be really busy trying to get as many 3-year policies on their books as they can prior to September.
Do a lot of your Medicare agents do under 65 stuff too?
They do. And if they don't, they should.
I don't, and I don't feel like I should.
Well, it depends. Again, where you're receiving your leads, it's keeping you busy. Now, if you were ever wanting to expand,
I refer a ton to our colleague who does do ACA.
That's kind of the problem. So if you're referring a bunch of it because, the wife is Medicare eligible, the husband's not, vice versa, then keep in mind that those people who are under age 65 will eventually be 65.
We got a spreadsheet, and he sends them back 3 months before.
If you have a referral partner, wonderful. As long as you have a hand in the process. If you are the referral partner, you push passing those back and forth, then great. You have to have a solution, even if you aren't the solution. But for other agents who are maybe trying to grow or keep that referral funnel or keep that funnel full, the ACA is a great way to get your, because they age in, and then you already have them with a higher producing product. So it's a great lead generation and referral generation. But if you're at a point where you're willing to turn away clients, then absolutely, as long as you're part of the process and you have a referral partner for that, and it doesn't fit your business, you don't need it.
I just felt like I didn't want to learn anymore. I
get that.
After my RSSA, I was like, I just don't want to learn anymore.
Yeah, I get that. You got a lot going on. You got a lot. So again, I think the best answer is you don't have to be the solution, but you have to have a solution.
I got one.
Okay.
Working good so far.
Speaking of being a solution, today on the Medicare Cafe, we're talking about shortening your PDP appointments. Now, this is obviously in line with what we've been talking about for the last almost month now, talking about how shopping rates for AEP is likely to jump from 12% to over 70%, knowing that, and knowing that not only will all of your appointments need to shorten, if your AEP appointments are an hour plus, you really need to get your Medicare Advantage appointments down to 30 minutes or less. Your PDP appointments need to go down to 15 minutes, if not 0, right? If you can eliminate PDP appointments altogether, that is what we have to do. But that does not mean getting rid of it.
So many of my PDP appointments are email correspondence.
Exactly. And that's all they have to be. They don't...
the majority, I feel like.
Your service does not have to decrease because your attention does, right? And making sure... We'll talk about it here in a second, but there is a lot of agents who are discussing okay, so PDPs are going to be nuts this year.
Yeah.
I don't make a lot of money on PDP plans. A lot of carriers are talking about eliminating commissions completely. Doing all the certifications, they're timely. Why the hell would I stay in the PDP market? And to that, I say you have to. But what's your thoughts on that? Knowing that, your time spent.
I mean, I'm such about efficiency. I see that it is... Even if PDPs become non-commissionable, it is truly the biggest worry that clients have. So I will always do them.
Yeah, I think that's key.
I will always do them, but I just set a precedence, just with my new clients I met yesterday. I told them, you'll hear from me in the fall. We might meet, we might not. I might just be telling you by email that the plane you're in is the one you should be in for 2025. So, I think telling them from the get-go.
Oh my God, I love it when we're on the same page.
That we may or may not meet. I just sets it up for them not expecting it. I do have the longer meetings I'll have during AEP that are, it's if somebody's in their MoGI in October, November.
So you have to
and we're doing
med
stuff too and
anyways.
PDPs. But like the majority of people, I do email.
No, I agree. And what you said about why you are sticking with you have to do PDPs, I think if you've worked with me long enough, you've heard me say, like, if you're an agency that does not do PDPs, does not enroll your clients, just says, here's Medicare.gov, here's the carriers, there you go. If you are that person, then that's like going to a dentist that doesn't clean your teeth. Like, the dentist does not make money off of teeth cleanings. It's not a profitable thing for them to do, but you couldn't imagine going to a dentist who's going to work on your cavity that says, you can clean your own teeth. Right. It's just something you come to expect. It is the number one way to save your clients money, to reinvest into other things. It is the only plan that your clients are almost guaranteed to use on a monthly basis, and they get penalized for not having.
Yeah.
So if you are going to be an advisor, you are going to be professional in this space, then you absolutely have to handle a plan that your clients are planning on using.
For sure. Just
common sense. But I understand with this AEP. Oh, and I didn't say this before. I'm getting some text messages. I didn't say before. That's my number. So text me if you have questions. But I do wholeheartedly understand that you do not have time to chase PDP business, especially this year when MAPD shopping rates are going to quadruple, if not more. So we have to find a way for you to become more efficient with your PDP business so that you are still providing that service, but not spending your time on that. And this is exactly what you were just talking about. So I love it when a plan comes together.
I know. And Christy, you should have been on the pre-chat.
Yes.
She said, I need help with Medicare Center. Can run quotes on there. Always go to Medicare app. That was literally the first thing I said to Olivia this morning is I need to train myself to leave Medicare app and get on Medicare Center, which I'm sure you'll talk about Medicare Center today.
We will. So, Christy, just so you know, again, we'll talk about why Medicare Center is a better platform to use this AEP when it comes to saving time on your PDPs and those appointments. But we will train you on how to utilize the platform. It's very intuitive. It works very similar to Medicare app. The difference is that Medicare app does a lot. Right. So Medicare, we launched right around 9:57. We talked about it a little bit then. But anyways, Medicare Center does a lot more than Medicare app. So there's just a lot more buttons and a lot more things to use it for, but it is a streamlined process we can teach you. Now, Erin, good morning, Erin. Erin said, I missed you last week, Erin. She says, unfortunately, I have a lot of PDP. However, I'm figuring out how to be quicker and still offer great service. That's what it all comes down to. And I think, again, you said this first, setting the expectation that, like, especially if you're working with clients who are used to an hour-long appointment during AEP or, working with somebody who is used to a full review of their prescriptions during that time of year, a full hour-long appointment for that, just setting the expectations, I think, is key. And because you don't want them to be disappointed when everything turned out the exact same way. They're getting the same service. They're getting the same benefits, but you want to make sure they, what they have their expectations.
And it's at least the last few years, it has been more than 50% of my clients. Like, I'm telling them to stay put. Mm-hmm. Why do you need 30 minutes of my time? Like, the rest of it is just them talking.
Well, I think a lot of agents,
which is important, obviously, on some level, but not during AEP.
During AEP. I think a lot of agents feel like, again, for a good reason, because in other appointments, you want them to be very involved, and they want to educate on what's happening, educate on the changes. And I absolutely can understand that. We can't afford that this year. We just can't afford to invest that time, knowing that a year that, and including a year where it's very possible when you say most of my clients just know to stay put, it's likely your clients won't be staying put this year.
My biggest fear is that, like, more and more people that are on MedSups and PDPs, they're going to want to say, well, can we meet to discuss the Advantage plans? And that's what's going to be hard.
And that could happen. That absolutely can happen. But keep in mind, those can be 30-minute appointments.
Yes, for sure.
Oftentimes, a lot of the work can be done ahead of time. You can send them technology to shop ahead of time, and you're getting paid a good amount for those MedSup to Medicare Advantage switches.
Yep.
So it is a worth of your investment to not only keep your MedSup people, and I'm not advocating to move into a Medicare Advantage plan, but if they're going to move, they need to move with you. So we'll talk about a lot of that. Now, Christy, she's saying that her carriers aren't loaded in there. Call our office. There must be something going on. So call us. We'll make sure that your stuff gets moved into Medicare Center.
I didn't even get that far to see if my carriers are on there. Would I know if they're on there?
Yes. Well,
I didn't see anything on there, so we're not.
Okay, so where did I put this? Okay, so here's one way. Again, here we've kind of talked about this, but the ideal appointment time during AEP is either 0 appointment time or 15 minutes and less. Your MAPD appointment should be kept to under 30 minutes, but outside of that, again, if you are doing a Medicare Advantage appointment, the PDP portion should be as minimal as possible.
Yep.
So let's talk about.
Can totally be done, or email.
And yeah, exactly, or email. Completely done over email. And if it is an existing,
sometimes we've texted.
Yeah, an existing client, easy. Quit yelling at Care Bear.
Did you yell at me?
Me, probably.
I'm so used to it, Brian. I don't even know it anymore.
I'm a very aggressive person. I do this a lot. This.
Don't know what that is.
It's the Shia LaBeouf, the TED Talk.
Oh, that's what he
Do it. Do you not seen that video?
I don't know. He's crazy.
Well, in this video for sure. Okay. So here's one thing that you can do, Carrie. I know we've talked about this a lot, but get the drug list as early as possible. If it's a returning client, obviously, one thing I like, train your clients to update you when their drug list updates. Yep. So if it's a returning client, making sure people ask, like, well, when can I start asking for these drug lists? When can I start asking for this? You can start asking for it now.
Yeah.
Under the understanding of, like, hey, if something changes between now and October 1st, you need to let me know, right? Just so training your clients on how to communicate with you.
I do that.
Now, let me ask you about this. One of the things I was asking my teammates and asking other agents, what are some things that you guys do to shorten these appointments? And one of them said, I run the drug list well before the appointment. So not only do they gather it before, but they run it beforehand. So tell me how
remember my AEP prep, what I do every night. God, yes. Every night I run through every appointment the next day. I have to because I'm so much more efficient. Because what if, what is it? Levothyroxine? Is it levothyroxine?
Girl, I don't know.
There's some drug.
You're speaking Spanish right now. I don't know.
There's some super common drug that the tablet is 50 cents, but if you put the capsule in there, it's $200.
Yikes. Okay.
So if you're running drug lists fast and you accidentally hit the capsule instead of the tablet, and I'm presenting it to them and I'm like, that's not what I was expecting. I will realize that, and I have time to go back and change it, so I don't have to worry the client.
Yeah.
Well, what just happened?
Yeah.
So I pre-run all of my appointments beforehand.
I love that, and you can do that between obviously October 1st through October 14th, whenever you're not allowed to sign applications, but still talk about the plan. So I think it's especially this year more than ever, you have to make good use out of the first 2 week, the marketing period through ANOX, through things like that, but also running through your appointments and getting those drug lists and whatnot. So making sure that you're doing that ahead of time. And here's the cool thing. If you have an admin or something that you're working with, your admin can do these illustrations for you.
Absolutely.
And what's critical, and so you want to make sure you're compliant. So your admin cannot talk to your beneficiary about the plan, but they can run the illustrations and do all of that ahead of time on your behalf. So if you have your admin team, using them to run those drug lists as AEP will be crucial.
One other thing that I always ask for that's with the drug list, I always ask if they've updated their pharmacies. Last year, I swear every person I met with changed pharmacies. And so having their updated pharmacy in there, again, will save you a couple minutes by having to update that, rerun the quotes. So ask for pharmacy stuff too.
Now, Chrissy, there are some agents out there that they leave the office at 9, 10 p.m. I know we work with an agency in Sedalia. They don't leave until midnight, right? And so, again, the thing that you can do, again, we stick by get the drug list early, get that information uploaded early so that your appointment is not spent communicating about the prescriptions. Your appointment time is only saying, okay, based on this medications, let's see what drug plans suit your lifestyle, suit your wallet. Medicare Advantage, let's see that, but not taking the time on administrative tasks like uploading those drug lists.
I start in September. We send out our letters requesting for updated drug lists. My assistant gets everything updated in the system, and then starting October 1st, I mean, we run everything. Sorry, we totally lost my train of thought
No,
reading
you're
one of
okay.
those questions.
Yeah. Well, so Mary says she still likes Medicare app better for a good reason,
I do
because
too.
Medicare app does have the ability to run multiple pharmacies. That is coming to Medicare Center, but I will tell you, Medicare Center is spending more of their resources and time trying to solve the drug list problem, trying to eliminate time in your appointment, not having a great way to so I'll say this, trying to find a great way to get clients to upload their own drug lists, to where you're not having to manually upload drug lists and things like that, getting clients a part of that process. So Mary, multiple pharmacies are coming. I will be honest, it's not the priority right now, because they're trying to find other ways for that too. William says, will clients be notified if their current PDP is eliminating some of their drugs prior to ANOX? So keep in mind, William, prescription drug plans can eliminate
at any time.
And they do not have to wait until the end of that plan year to change their formularies. Now, to change like the cost sharing of the formularies and of those tiers, that has to stay the same. But like, they can change what medications show up where at any point throughout the year. And yes, consumers do get notified of that.
So I just had a thought, not totally sidetracked, but like just thinking of the drug formularies are going to look completely different next year.
Yes. So even like
there won't be an initial coverage limit. There won't be.
Well, it'll be, again, the 2000, the levels will look different. Yes, there is.
So is there still going to be a initial coverage limit, catastrophic, things like that? Or is it just going to be premium, maybe a deductible and a cap?
You will have a deductible this year.
Yeah.
I can guarantee you will have a deductible this year. So premium, deductible, and then, of course, and then the MOOP will be how those levels look this year. Yes. So that will look very different. We're redoing all of our trainings, redoing everything to like our consumer facing stuff, our partner facing stuff, so that you guys have access to that. But yeah, it will look really different. Terry says another reason to offer PDP is if you don't at least offer and they get sick later. I see an E&O complaint going on because they needed the medication. I am a huge believer, Terry, me and you both. Yeah. I am a huge believer that not cross-selling, not offering cancer insurance, short-term care, life insurance, things like that will eventually be an E&O claim, because you're claiming to be the advisor, the expert. You're not advising them on holes in coverage. I really see that will be an E&O claim, but that's neither here or there. Time for another day. But again, ways to get those drug lists ahead of time. Medicare Center is working on. Right now, Medicare Center has an incredible consumer-facing called Plan Enroll. It's your personal agent website. It is consumer-facing. But what's really cool is that a consumer can get on there and create their own profiles, upload their medications, upload their doctors, upload all of that, and it does show up on your Medicare Center site. What's cool is something that Medicare Center is working on feverishly is a way for you to actually send that out to your clients so that they can go ahead and update their own medications and things like that. So allowing them to be more involved. And again, those baby boomers, they're hungry for it. They're the researchers, right? So not only are they the ones that love the technology, will have this personal URL, will have this database for it, but it allows them to get on there and shop for plans before you're even involved. So it gives them a little bit more freedom to research on your terms, not research on Google or a competitor site as well.
Some of that I feel like would only work. I love that that's happening. However, I feel like there's like maybe 25% of my clients that I would feel comfortable sending that to.
Yeah, and that's super fair. As far as like uploading their own drug list.
Yeah, like
really,
I just don't feel like. I don't know. See, that's when we're looking at depth research and we're looking at what they're saying about the people who are turning 65. They're the ones who are excited about this technology and want to utilize those.
It. Now
it's my younger clients.
Yeah, now your 75 to 85-year-old clients, this may not be an option for them. They may not have these capabilities. But the type of clients that we're wanting to attract, which is those longer clients, they're hungry for this. They want this. We can knock out a big portion of that business by getting them involved.
We got lots of questions here.
Yeah.
Will clients be notified? With the Plan Enroll link, if they are a current client, is there a way to combine if they are existing in Medicare Center?
They're working on it, Michelle. But yes, there is a way. They're working on a way for you to combine profiles. But hopefully, with these new updates, it won't be a problem. It won't be a problem to have to combine those.
Yeah, like what Sherry said, if they don't enter their drug correctly, that's an issue. That's I guess what I was thinking of. Like, they're not gonna know the difference between a tablet and a capsule?
Well, it works the same way as it does now. So you'll enter in their medications, and it'll pre-populate with these things to enter in that information. So it'll knock out a good portion of it.
I still just worry. I don't know. And maybe that's me not trusting in my client.
I think that's the control freak in you.
Could be.
And the fact that you prepare and then you run the appointments and you over prepare.
It could be.
With you personally not doing it. But we'll see. I will 100% agree. It will not work for all of your clients.
Yeah.
It will not work for all of them.
My goodness. Brian, they'll mess it up to one step closer to them doing it themselves on Medicare.gov.
So yeah, and that's something.
That's a good point.
Here's the point. Here's the point with this. They are doing it. So knowing that whenever they are going online, especially these people who are turning 65, they are going online. They are looking for options. They are doing the shopping. This allows you to be the solution and be a part of that process versus going to the other tool, which is Medicare.gov, where you're completely left out of it.
But wait a minute. How is this beneficial if they're already my clients? I should already have all their drugs in the system anyways.
Yes.
So what am I even sending them?
Well, if they've had changes,
had an update,
if they've had changes in their medications, if they've dropped any medications, added any medications, or people who are new to you, people who
are meeting for the first time.
You're meeting for the first time that you don't have their information.
Yeah.
So being able to change that drug information as well as allowing you to add new people to your database without you taking the time to actually add them yourselves.
Right.
So that is.
I'm gonna see myself doing some test runs with I've got 5 really trusted clients.
Of course, test it out.
Back on this.
Test it out. See what they experience. I'm knowing that the experience is gonna look a little bit different come June. Because that's
come June?
Yes, come June. That's whenever the updates to the agent website are happening and the consumer facing stuff. So June will look a little bit different, hopefully a little bit more streamlined, and then the ability to actually send that out to your clients will be hopefully coming later on before EP as well. So updates are coming to that.
I'm really curious about Kim's question. Can you talk about Medicare and the GLP-1 drugs?
No,
What is that?
I don't know. I cannot talk about that. I don't know what that is. I would love to. I have no idea what that is.
I've never heard GLP-1.
I have no idea what that is, Kim. I am so sorry.
More and more clients asking about those. Yeah, I've never heard of that.
Mm-hmm.
Oh gosh. Ozempic, Wegovy. Is it Wegovy?
Yeah. I've not seen anything on Medicare.
Ugh.
I do know on the underage market, on the short-term medical and on the group side, I have seen those medications get approved by insurance whenever somebody is considered a morbidly obese and they have to lose weight for an upcoming surgery, or they have to lose weight for health concerns where it's truly becoming a health concern about that. I've not seen Medicare. I did see something come out on Medicare, but it's been months ago. I don't remember. I hate to even comment on that because I don't remember.
I have a good comment on this. I have a client who we're in an appeal process to get Wegovy. I feel like I'm saying it wrong, to get it covered. He appealed it with WellCare and they denied his appeal. And the reason, I will find here in a second. I got it. The FDA approved Wegovy for weight loss. For the drug to be covered, the client must have cardiovascular disease and obesity. Both conditions combined are the necessary criteria for Medicare to cover that drug. So cardiovascular disease and obesity.
Coming down again to medically necessary. So just using it for weight loss is not the same thing as
even if it just obesity. It has to. They have to have COPD or whatever. And that the PCP had to have certain medical criteria to submit to Wegovy. The doctor, they had med records, and they still didn't approve it for him. And he was like, I need it. And I'm like, talk to your doctor? I don't know.
So just to kind of put a bow on the Medicare Center talk about, do we trust our clients to be a part of that? So this does not replace confirming the medications, to be clear.
Gosh,
I am not advocating for a client going on there, shopping for themselves and enrolling in themselves without your interaction with that. I'm not advocating for that because I do think that is a slippery slope. Training your clients that you don't need to be a part of that process is a slippery slope that I don't recommend. What I'm saying, though, is, and what I'm trying to convey is with the Medicare Center side, you're getting rid of the administrative work. And so obviously when that person, you're talking to them or you're emailing back and forth, either it was an appointment or just communications via non-face-to-face, you're confirming those, you're making sure the information is correct, just like you do in every other appointment, like you have to do compliantly in every other appointment, but you're not physically taking the time to enter in those medications yourself.
Everything
else is the same.
I could see me doing this for my new clients and like it being something in moving forward.
Yeah.
I do see, I forget who said something, Brian, that some of my current clients who've been with me 5 years are now like, you want me to do this? Like,
of course.
I could see not doing it for current clients because they're not used to it.
I think it's about you present them the options.
Yes.
Again, the research is showing that people are hungry for this. Keep in mind, guys, this is going to be the year. It's going to be a confusing year for so many reasons.
Yeah.
Number one, it's an election year. And Medicare is going to be a hot topic this year. So there's going to be a lot of misconceptions. There's going to be a lot of people who are hungry. Two, their plans are going to go haywire this year. And there's going to be a lot of concern about, what am I going to do? Where am I going to go? What does that look like? So your clients who are going to be doing the research, it will happen. I understand that your clients know you, they love you, they're not going to talk to anybody else. We can feel that and understand that. It will be a year of chaos where they are going to be searching aggressively for answers. And you want to make sure you can be a part of that process from beginning to end. So that's why it's important for you to have a website where people can go on there and research and look at the information, look at the plans, and you're still a part of the process every step of the way.
That's a good question, Michelle. Will there be an activity log showing that the clients made changes?
Not only will there be an activity log, but you will get notified via your email as well.
There are definitely people who are willing and able to do this, but a lot who are not, and agree that I'd rather have them do it on my site, my watch, than on Medicare.gov.
Exactly.
Sure.
It's just offering another way to make sure that you remain a part of the process every step of the way. So, the next things we can do, again, education before the appointment. Anything that you can convey to your clients prior to you sitting across the table for them or you being on the phone with them, including things like ANOC meetings. That's obviously more so for the Medicare Advantage side, but like educating in a bulk setting about what their plan's going to do for 2025. That can be done between October 1st and October 14th. Waiting room materials. If you have a waiting room, what is somebody ingesting while they're there? Are they looking at outdated magazines, or do you have like a TV scrolling of all the products that you offer, all the changes that you have going on? So like making like their environment do a lot of the work for you, right?
Yeah.
Making sure like what part of the education are you a part of? And then last but not least, your social media posts, doing videos about the IRA, doing videos about the importance of working with an agent, things like that, using your platform on social media to get a lot of that education across up front as well. Just keep in mind, if you're doing anything on a math basis, like using social media, premium, benefits, plan names, keep that completely out of it. Because then it becomes marketing, not communication. It has to be CMS approved. So we don't want that. Yeah.
I finally feel like really comfortable with social media.
Oh, you're Medicare.
Like I feel really
deal.
comfortable. Like I don't stress about what I'm posting. Like, is this like, am I giving too much? No, like everything is educational.
Oh yeah.
And what's crazy is my Social Security posts get thousands more interactions than Medicare, which is interesting.
I think Social
I think
Security
it's because it's more political.
It's more political.
Yeah.
It's a buzz term. And plus, like, Medicare, so the only people who are interested on Medicare are people who are 6 months before they turn 65.
Right. Social Security affects
until
everybody.
they're 66, right? And then after that, their Medicare is going to do what Medicare does.
Yeah.
Social Security affects a lot more people.
Yeah.
And it doesn't matter if they've been on Medicare for 20 years. Social Security's, there's still new things all the time with
Good
Social Security.
point.
So it's more of a buzz. But that's good to know. And you are the RSA certified. So that is why you have the authority and the license, the certification to talk about Social Security as an expert.
It's just interesting. Like I wouldn't think it would be that significant, but it is significant.
Yeah, for sure. So again, when it comes to when we go back here, where did I go? Did I skip
The
from
last
here?
one.
Yeah. Well, so yes, frequently asked questions. I also want to put it on here too. Using Medicare Center, we did kind of talk about that. When that works, when it doesn't. But keep in mind with Medicare Center, you do have the ability to text or email that application as well. So that if you aren't doing a face-to-face appointment, if all of this is communicated via text, email, or on the phone, you do have the ability to send them an application. And again, an opportunity to eliminate a face-to-face appointment completely.
I'm ready. I'm ready for AEP.
I know, I love it.
It could be tomorrow. You know,
she's golden. So yeah, I got a really interesting question, and that's the end of this Medicare Cafe. We've talked about shortening PDP appointment. We'd love to hear more if you have any questions on it. I did get a lot of really cool questions.
It cracks me up. This is like a record amount of comments today.
I love it.
I'm guessing the TV ads this AEP will confuse the hell out of a lot of folks who may panic and shop before calling us.
I'm telling you.
Aren't there saying there are going to be less TV ads? On Medicare, wasn't there some?
So,
maybe not. Prepare for them.
Advertising is going to be really difficult to do this year because most of the advertising, the ads, the mails, the time slots is going to get much more expensive for a lot of different reasons, the election being one of them, and then the updates to the FTC. So will there be less Medicare specific advertising? I don't think so. I think it'll just be more personalized, and it'll be people who can afford to do it. So carriers and call centers will be aggressive because they can afford the higher prices of the election. They have the direct line, especially carriers have the direct line to CMS to get things approved. So local stuff will be less. Carriers and call centers, I think, will be much higher.
Whatever happened to the ruling about like you can't have Medicare in your name? Because I feel like did that not happen? Because I still know tons of people that use
the ruling was
the term
different.
Medicare.
Yeah, it was certain states adopted that the word Medicare cannot be in your name. Everywhere else they lessened the stance, and it was more so about like you had to make it very clear with all the disclaimers that you yourself are not Medicare. So states like Florida adopted that, but not everyone did.
Just curious.
Yes. But William, to your point, yeah, the TV ads and AEP will confuse like a lot of people. That's what I'm saying, guys. Like, you have to be everywhere this year. Online, in your office, in their homes. You have to be everywhere. I don't care how loyal of a client you have. And here's the thing, like, we'll get into this. They will be, if they're not doing the research online, they're asking their neighbor, they're asking their family, they're asking everybody around them what to do this AEP. Even though you're the expert, even though you've trained them to talk to you, they're going to talk about it this year. And you want to do everything you can to be the answer in that equation, whether it's them doing their own research, whether it's them that they request that appointment, whether they want nothing to change, period. You have to be much more flexible this year and understand that you may have to get out of your own comfort zone. Because if you're expecting 70%, just look at your block of business. If you're expecting 70% of your block of business to do some shopping this year and need an appointment, do the math. How many working days, even if you work weekends, how many working days are between October 15th and December 7th?
Not enough.
If you have a book of business that's 300 clients or more, you do not have space in your calendar to fit them all for an appointment. So I understand that it's uncomfortable. My clients expect this out of me. My clients want this out of me. I don't know that I trust my clients to do this. Then that's fine. All you're going to do this year is retain your book of business. You will not have the capacity to grow. And that's just kind of if the math, look at the math, look at your appointment times, the time that you have in your schedule. You have to make sure that you're able to retain. That's fine. But if you want to grow this year, if you want to share of that 70% who's going to be looking and shopping plans this year, if you want your share of that, your AEP will have to look different. And systems and processes will have to be part of that.
Can you on social media ask them to be preparing drug lists before AEP?
Absolutely.
Or do you have to wait? Has compliance created a letter to go to clients for this summer yet?
So we have our letter that's basically requesting drug lists and things like that. Hang tight because I'm really positive that Medicare Center will have a solution to request those drug lists. Medicare Center is also coming up with marketing materials that you can send directly from Medicare Center. that will include some of the communications about drug list and AEP and things like that. But you can start requesting, again, you can start requesting drug lists and updating a consumer's file. You can request that now. The only thing you can't do prior to October 1st is talk about changes to benefits coming up to this 2025 year. You cannot talk about 2025 premium, MOOPs, anything like that until after October 1st. So, but you can start collecting that information now.
I just sent out a spring newsletter for the first time.
Did you? Mm-hmm. Did you do mail or email?
Mail and
That's
email.
Awesome. I love that. Give them the 1-2 punch. I love that.
Are we expecting the WellCare Value Script and Aetna Smart Saver plans will be used as loss leaders for the companies, or will they be taking a significant increase?
Where do you see that? Are we expecting the WellCare Value? Yeah.
Mary.
So there's a lot of plans like the WellCare ones. Everybody's asking about that 0 premium or 50 cents. To be fair, these carriers do not make money on prescription drug plans, just like agents don't make a lot of money on prescription drug plans. They're 100%, hey, why don't we try to talk to this person about a Medicare Advantage plan with our company versus
there
a PDP?
Still has to be a low one. I have faith there's going to be a low one.
I think there will.
I bet there will be one under 10. That's my
I don't know about
goal.
that. I think that you will for sure have a lower premium PDP. The formulary will just be trash, but that's okay. That's okay
because there's still so many people that don't take drugs.
They don't take drugs yet. So
I know.
I'd hate to put somebody on a prescription drug plan based on what they're taking in January, knowing that if February, March, something terrible happens to them and now they have to pay astronomical. But if they know that, then okay, and they're comfortable. It's not you telling your clients what to do. It's telling them the pros and the cons, advising them on the situation, and seeing where they're more comfortable with the risk.
Yeah.
Are they more comfortable with the risk saying, like, I don't want to pay a ton of money and not use this plan? So perfect. That's the risk they're comfortable with. Mm-hmm. Or are they uncomfortable with, like, yeah, I don't really want a plan that costs this little, knowing that if I need it, it's not going to be there for me. Then that's the risk they're comfortable with. Yep. That's the point of this AEP. It's your questions that you ask your clients on what they value is going to have to be different. You're not just going to have to ask, well, this plan and this plan look similar. Would you rather have golf clubs or a gym membership? That's not the question anymore. It's, do you value your plan being there when you need it, or do you value low cost and the bells and whistles? It's going to look different this year. Mary asked the question, what am I missing? Isn't that typical every year? Local is more direct mail than radio or ads or TV. Mary, yeah, obviously the people with the higher budgets are going to have more screen time. And that's not me. That's going to be carriers and call centers. They have the budgets to afford that screen time.
I think you got all of them.
Yeah. Brian.
I know, cracking me up
I love
today.
it. And again, like, not saying that, like, I'm arguing with Carrie about, like, what she's going to do for her clients. What I'm saying is that this AEP, if you want to take advantage of the market, saying, well, this is what I always do, it won't work this year. If you just want to retain your book of business, and there's nothing wrong with that, if you just want to hold on to what you have, then do it. But just know you're going to be busier this year because you're going to have more appointments this year. If you're wanting to figure out how do I take advantage of shopping for people who agents are not as good as you, agents who are not as good as others, and saying those orphaned agents, how do you take advantage of that? It's going to be systems and processes and seeing what you can get by. How do you duplicate yourself using systems and processes? Because you can't be in 2 appointments at the same time. Christy, I'm glad that you asked this question because it's blurry right now, and I'm talking to our compliance officer about it. But she's saying we can't tell our clients about the new CMS changes, like what the plans will look like, different potential.
Absolutely, you can. So the Inflation Reduction Act is public knowledge.
So the Inflation Reduction Act, 100%.
I talk about that all the time.
You can tell everybody about what is going to happen with the Inflation Reduction Act, the $2,000 MOOP, and things like that.
Yep.
Where it gets a little blurry is talking about Part D premiums. Max out of pockets, because you're talking specifically about what 2025.
We don't even know what they are yet.
So this is why I'm not saying I know the answer one way or the other. I'm saying that it's a gray area. I'm saying that, like, I'm trying to get clarification on if you're talking about what could happen with the premiums, because you're not supposed to talk about, CMS says you cannot talk about 2025 premiums, 2025 benefits until after October 1st. So if you're going to be talking about 2025 premiums, 2025, if you're going to be talking about that, you are breaking CMS regulation. What I don't know the answer to is if it's okay, since we don't know specifics, since you're not giving specifics, it's going to go up by 50%. These are going to go down. I don't know that answer.
I have been saying, like, yeah, we're expecting a lot of changes in 2025. We don't know a lot of them, but we do know the Inflation Reduction Act is going to create a $2,000 cap for drugs, and that's really the direction I go every time.
Yeah, and you can obviously...
It's true. I'm not saying any...
No, you can obviously talk about what the IRA says, because that is public. That's not CMS. That's not like a... like a thing that clients are supposed to know.
Right.
Yeah, that's very, I just don't know, again, when talking about how will plans be affected. I am cloudy on if we can or not. I'm getting clarification on that.
She's getting clarification.
Yes. Thank you guys for staying on a bit longer. Yeah, I know you got to get out of here. With respect to the low-cost plan and educating on them about their rights to ask for an exception.
Yep.
Yeah.
I do that.
Still can always do that. None of that changes. Just know that
maybe next time we should have a Ask Me Anything.
Yeah, if you guys are interested in that and Ask Me Anything and just make that the entire episode, I will be here next week. Yes, it's the week after that I will be doing Devoted Medicare Advantage. They're doing their rollout. So I will have even more Devoted, being more of a regional carrier that's gaining footprint in a lot of places, including Missouri. They're coming to Missouri this year. So their rollout is the first week of June. So I will be talking to them about how they plan to handle these changes. So I'll have more information then.
Fun stuff.
Okay. Any questions, comments, concerns, threats, or promises, please let me know. But yeah, again, we'll continue to have these conversations. We need to figure out what the problems are going to be, what the rub points are going to be, and figure out how we can solve them together. So that's the plan. Awesome.
Thanks for all the info.
All right, team. Yes, if you go to smsteam.net, click on the AEP toolkit, there are compliant letters there, like requesting. And what you're doing is you're just saying client updates. Like I need what's it called? What's it called whenever you are a person in a CRM? I think it starts with an R.
I don't know what you're saying.
It's not report. Anyways, an update to the, yeah. For what? All right, team. So until next time, have fun.
Make money.
And give impeccable service. Thanks, y'all.